Hello everyone, I hope you're all well. So, this is the fourth video in the Path to Recovery series. In the last video I spoke about who is out there that can help you, who's available, willing and able to help you find your path to recovery. Now in this video I'm going to talk about the methods, treatments, devices that can and do help with your recovery from tinnitus. I'm also going to try and explain briefly how these methods and treatments work, and in my opinion how and why they are helpful with tinnitus. How do they work? Are they any good? So let's start with the mainstream medical world and the accepted approaches. The mainstream medical world and their accepted usual approaches. Maskers and shrouders. Now, on maskers and shrouders I've spoken many times, including in my last video, so some of you may wish to skip this part, although I will be going into a little more detail in this video. So what are they? Maskers and shrouders, sound generators, are devices similar in appearance to hearing aids that are worn in your ear, but they are not hearing aids, and they're not designed to improve hearing. In fact, tinnitus maskers are actually designed for people with normal range of hearing, which rather contradicts the notion that tinnitus and hearing loss have to accompany each other to exist. So that contradicts that, but I'm not going to get into that. Let's concentrate on the devices themselves. Maskers put out different spectrums of sound: white noise, pink noise, brown noise, but you can also have real life sounds recorded into these, such as raindrops, waves, and some people even have the sound of crickets produced by their sound generators. So there's a multiple of sound choices with these. You've also got the option of either what they call open domes or closed ear plugs. With the open ear domes, these allow you to still hear ambient sound, which is a lot better than closed in plugs, in my opinion. Okay, as why do I say that? In closing your ear with an earplug, and closing your ear completely with an earplug can be problematic in regards to it can concentrate the inner sound of your own body and brain, including tinnitus. So open domes are better. How do they work? Well, clues in the name. One of the ways that these work is that literally they mask the sound and shroud the sound of the tinnitus. So instead of hearing the tinnitus tone, you're hearing the sound of the masker, which is more bearable. However, the other way that these can work, in which these maskers or sound generators can be configured, is that they can be configured to, so instead of masking the sound completely, what they do, they match the frequency of the tinnitus that you hear in tone in a way to balance and cancel it out. I've had people tell me that this is the best option for trying to lower the tinnitus to a point where you're not hearing it. So yeah, they cancel out the sound of the tinnitus. That's the idea with that. Do they help and do they work? What do I think? In my opinion and my experience with maskers, sound generators, they can be helpful in allowing the tinnitus sufferer to gain some instant relief and allow them to escape the tinnitus for a while, okay, so they can give an instant relief. For some that have just suddenly been struck, they can be of help in allowing some relief. Also at night when you're trying to get to sleep, sound generators can be useful, although I would say much better to have a device next to you when you're asleep on a sideboard or a table rather than something plugged actually into your ears. Okay, so in these regards the devices are or can be useful. However, they are not, in my opinion, a long-term answer or solution, and should be considered more of a short-term relief that will allow you time to gather yourself towards a more sustainable path to recovery. I personally think that using a masker, particularly the maskers where you're literally shrouding the sound of the tinnitus, can actually hinder your recovery. If you use these devices constantly and long term, I think that can hinder you from making a natural recovery. Why would I think this? In my view, if you're constantly masking and shrouding the tinnitus tone with another sound, you're not allowing the brain to realise it does not need to hear or create the tinnitus tone. You're not giving the brain the opportunity to reprioritise the tinnitus into the background, into the subconscious, to the point you no longer hear it. That's what I think. So to sum up, do I think they're any good? Yes, they can be helpful and give an instant relief, but I think people can become too reliant on them. I think they should be thought of as a short-term relief rather than a long-term strategy for recovery. You should be able to get these on the NHS. There are private clinics that can offer you more in terms of choice on these. There's other sound therapy devices such as neuromodulation, which is something different again, where you have a device similar to like an iPod type thing, okay, that plugs into your ears, but also you have an electrode that resembles like a lollipop that you have in your mouth, on your tongue, that sends out tiny electric pulses. The jury's still out on the validity of those, but I would still say they're not the long-term answer, in my opinion. Now I'm going to touch on another mainstream approach often put to those with tinnitus. Okay, and that's drugs. This will be quick. This is going to be quick, as I'm not qualified to talk or explain the entire premise of drugs or drug use for tinnitus. And my opinion is, at this time, there's not, as far as I'm aware, any drugs available that I could or would recommend to take as part of a path to recovery. The majority of us will have been offered some form of drug or another at some point by our GP. Antidepressants or such like. In my experience with drugs, those that I have spoken to, drugs, and I agree, drugs should only be considered if you're in such a low state of mind that you can't function at all, and you need to have a period of time where the antidepressant will allow you time to gather yourself and be able to function. Other drugs that suppress your thought process, such as gabapentin, there are others, but gabapentin comes to mind, should also, if possible, be avoided. The problem with drugs like gabapentin, and I know because I took it, is that I found while it worked, and it did work in that it took the tinnitus volume right down, alright, so it worked. The problem with that is the way it works, with the lowering of the tinnitus, it also, the side effects, it also affects every other part of your thought process in negative ways. So, as I say, if you're at a point of jumping off the cliff and just can't function, then maybe medication can be of help for a period of time. But aside from that scenario, if at all possible, avoid the use of drugs, steer clear. So now, I'm going to get into methods and treatments and practices that I'm far more inclined to advocate. We will start with the ones, I'll start talking about the ones that you would need some outside help to put into play on your path to recovery, and then after those I will cover the methods that you can put into practice yourself, by yourself. So, I'm going to talk on a method of treatment that I advocate and personally find to be extremely helpful and beneficial for healing and recovery from tinnitus. And it's going to be no surprise to many of you that I'm going to be talking about cranial sacral therapy. So what is craniosacral therapy? Craniosacral therapy, in simple terms, is an osteopathic treatment modality. It's used by osteopaths and massage therapists. It's a light touch, non-invasive treatment that is trying to improve the homeostasis of the body and mind. And this is achieved by manipulation of the bones and tissues connected to our central nervous system, which of course include the brain and the spinal cord. Further on from that, the central nervous system is connected to the craniosacral nervous system, which includes our skull, spinal cord, spinal fluid, the sacrum, etc., as well as the membranes that cover the entire body, such as fascia. All of this, in turn, is connected and affects our sympathetic and parasympathetic nervous system, which is a network of nerves that help with your fight or flight response. Our fight or flight response is affected by our emotional state, and factors such as stress, anxiety, anger, all these negative emotions, affect our emotional state, which affects our tinnitus. And it's the premise of this as a reason or reasons that, in my opinion, why sacral therapy is an excellent way and method to help in healing and recovery from tinnitus. How does it work? Okay, how does it work? I don't think that anyone truly knows how exactly craniosacral therapy works. Even the people at the top of their game with this, I don't think anyone truly knows exactly what's going on. However, craniosacral therapy, in my opinion, works on a multitude of factors and levels. It really is a healing therapy for the mind, body and soul. That sounds very zen, but that's how I would describe it. So, to begin with, what I'm going to do is I'm going to cover how it works, why it works, to begin with from a biomechanical viewpoint, the physical aspect, let's say that. What do I mean by this? By manipulation of the body in certain areas, such as the skull, the spine, the sacrum, by manipulation of these areas with the therapy, the light touch, almost similar to acupuncture but with the hands. Okay, by manipulation of these parts of these areas of the body and the nervous system, we're able to find and encourage release of blockage and encourage balance and calmness to reach a state of true, what I call true relaxation. There's differing theories. There are differing theories as to what is actually occurring and taking place during a session within the physical application of craniosacral therapy. But one of the most agreed positions on this, and one that I tend to go along with, is that during this session we're able to open areas of blockage to release and increase the flowing of the spinal fluid from the brain through the spinal column to nourish and protect the nervous system, which again includes the brain and the spinal cord. Once we do this, the individual hopefully should have an experience of physical and emotional release, a state of true release, relaxation and calmness, both physically, mentally and emotionally. Now, note emotional. Okay, so aside from the physical, the physical aspect of what is occurring, the spinal fluid, aside from that theory, there is the emotional connection factor, and that's the other side that I believe is the reason that craniosacral therapy works for tinnitus, because it's this emotional release and calming factor, in my opinion, why cranial therapy is beneficial. And in the treatment of tinnitus, it may require several sessions before the therapist is able to access and learn what each individual responds to. So it's rare that you will go in for your first session and have the results that I'm speaking about, this sense of complete release in your first session. It can happen, but it's rare. I would say it's more likely, in my experience, to be between 3 and 6 sessions will probably be needed for you to be relaxed and open enough to allow the therapist to be able to know what you are responding to. However, once you find this place of where you are responding to the therapy, it's common to experience really very intense reactions of, to use a phrase, letting go. Okay, I've seen people where it was such an intense experience that they are actually in tears of relief and elation after having suffered for so long. I've literally seen people in tears. It's been such a impactful reaction to this kind of therapy. Having said that, this therapy does usually require some amount of time and patience and consistency while you and your therapist learn the areas of your body that have the most beneficial response and reaction for you. Now for men, what I found is the area at the back of the skull seems to be particularly sensitive to this kind of therapy. Certainly for myself and others, men usually that I speak to, for some reason that area at the back of the skull seems to be particularly sensitive and open to this therapy being beneficial. Does it help and does it work? I advocate craniosacral therapy. I've found it has a very positive result in helping lower tinnitus personally and with the clients that I talk to, and it does therefore help them find a path to recovery. I also advise others that don't have tinnitus to indulge in some time for themselves and try craniotherapy. Why would I do that? We know tinnitus feeds from and increases when we're in an emotional negative state, fear, anger, anxiety, etc. Tinnitus feeds from negative emotions and increases when we're in that state of mind. Okay, in my opinion, cranial therapy is excellent in that it can produce a sense of physical and emotional release and a cause calmness to return and true relaxation to return, which of course is helpful in coming out of stress, anxiety, anger, etc. And in this, the tinnitus tone will become less and less prominent in the conscious mind, being reprioritised into the background. Now, I advise people that don't have tinnitus to also try this because it's just fantastic at release of stress. Okay, so I advise people with tinnitus and without tinnitus to try craniosacral therapy. So I really do advocate it, which is why, as you know, I am in the process of training to become a craniosacral therapist myself. You can see I've got my massage table. So I'm in the process of hopefully becoming a therapist myself. So that's how much I kind of believe in this. And I am not, for those of you that are new to my channel, I am not one of these, how can I put it, Zen type guru type people at all. Okay, it takes a lot to convince me of anything. I am a skeptical person. Okay, there's certain things that I don't believe in still, that others tell me has helped, but there are things that I don't believe in. I don't believe in crystals. I don't believe in, this is controversial, I don't really believe in Reiki. Okay, so when I say something is actually tangible and works, you can take it that it does. Okay, because I wouldn't advocate something that I don't truly believe actually works. And craniosacral therapy, something is going on with this. Okay, it is beneficial. It can and does have an effect. It can, and I'm confident will help you. Okay, so that's it, I think, for this video. There will be a part 2 in which I will talk further on other methods, treatments and practices that can help you find your path to recovery. And I look forward to seeing you again soon. Best wishes to everybody. Bye bye.